Dr. Marty Makary of the Johns Hopkins Bloomberg School of Public Health is with us live tonight from Washington. Doctor, it's good to have you with us.
Good to be with you, Scott.
Should this have been done earlier, all of this?
Yeah, look, we're way behind the eight ball. The signs were out there for 3 months. We've been watching what's happening in China. My team has been talking to doctors in China and more recently Italy. Look, this virus is following the playbook. It's doing exactly what was predicted. The study out of Harvard 3 weeks ago said that 40 to 70% of the U.S. population could get infected. And yet many of us were seen as alarmists and talking, too much of this thing. What is the danger in having a public that's over-prepared and we look back and say it wasn't quite as bad as the projections? This is a playbook that we are watching in Italy. China's not been transparent and Iran has not been transparent, but Italy has been totally transparent. Look at the numbers there. It's probably the best indicator in terms of case fatalities. Look at their hospitals that are overrun in Basica and Lombardy, and you will see what will play out in the United States unless there's some miracle.
Dr. Fauci today said, quote, "It's a failing. Let's admit it." There's another comment tonight from the director of Harvard Global Health Institute who said, and I quote, "This is an unmitigated disaster that the administration has brought upon the population, and I do not say this lightly. We have had a much worse response than Iran, than Italy, than China, and South Korea." You agree?
Well, look, the blame game is going around, but I think the administration and the CDC has been pretty honest that they had a massive mistake with the testing and the rollout of the testing, and they are doing everything they can. They've owned the mistake. We've got to move forward. But to be honest with you, what has Dr. Anthony Fauci been saying? He has been giving the most generic and vague recommendations, completely absent from what he has been saying on every network, and he's the doc that every network has on, has been no preparation details, no specifics. What about closing our schools? What about contingency plans for public events? What about what businesses do? What about an employee that doesn't feel comfortable coming into her job as a cashier? These are the specifics where we need specific plans and we need to do something. And it's been many of us in public health that have been running around talking. Heck, I had to directly reach out to the mayor of Austin and beg him to cancel by Southwest. I talked to the NCAA. We're out there telling people to get prepared. And why are we not hearing this from Anthony Fauci?
The president, you think the president's been honest about the testing? March 10th, according to my notes, quote, "The U.S. has done a great job on testing. It's really working out." Is that true?
Look, the president is not a virologist and didn't go to medical school. He's relying on our Center for Infectious Diseases, which is led by Dr. Anthony Fauci. The CDC messed up the initial test, and they've owned that. Let's move on. And right now, I still have parents that tell me, oh, we're going to our kids' swim meet in 3 weeks. Well, guess what? We're about to experience the greatest pandemic of the generation since polio. Get prepared. We've got to raise awareness, and that's what I'm concerned about. We still don't have awareness out there.
Mayor de Blasio, New York City, declaring a state of emergency this evening, saying, quote, "We're getting into a situation where the only analogy is war," saying he foresees a situation where, among other things, hospitals are setting up tents in parking lots to deal with the patients that we might find. It's come to that.
Look, I think every household, regardless of what politicians and government leaders say, every household should declare a state of emergency, get 3 months of food and necessary medications, whatever essential meds somebody might be on, and get ready to hunker down. Look, we're going to see probably over 1,000 deaths per day during the peak of this thing. That's not something we're prepared for. We still have folks who are required to show up for work. We need contingency plans. We need restaurants to move into the delivery business so they can focus on staying alive and supporting people. We need to take care of our own. We're Americans. We need to visit our seniors and leave food for them and call our seniors. So look, we still have schools open around the country. We still have people in denial. We need to raise awareness in the absence of other people not doing so.
Sir, there are suggestions that some of the administration are the ones who are in denial. Namely, the vice president who's been leading this effort, who continues to suggest, now he hasn't done it today, but saying that the risk of contracting this virus for the average American is relatively low. I hear you telling me this evening that I need to stock up on 3 months of food. Why the difference?
Well, look, again, our government leaders have relied entirely on our Center for Infectious Diseases, which is Dr. Anthony Fauci. And on every network, the media talks about how he is America's doctor. It was in the congressional hearing. But when he was asked how many people have the infection, he said, we don't know. Well, guess what? Probably 250,000 to 500,000 people have it. Probably it is ubiquitous, and this idea of it being contained is an idea we need to abandon. We need to do some dramatic measures, probably similar to what we're seeing in Italy and other countries. We need to get ready to shut down a lot of customer-facing businesses in the United States, and I don't say that lightly. Look, I don't like it. I want to see the NCAA basketball tournament, but we've got to hunker down, and the good news is, in 3 months, this thing will be over. Historically, we know pandemics take 3 months. That was the Spanish flu in 1918. That was the SARS epidemic. We will be beyond this come June or early summer. So we've got to take temporary but yet severe measures to take care of our nation's most vulnerables, those with organ transplants, seniors, those with immunodeficiencies, those with disabilities. We've got to take care of each other and take this seriously.
We need to test people. That seems to be the issue. I'm looking at a graph right now that says we lag so far behind other countries in testing. It's a disgrace. Bahrain, South Korea, Italy, Austria, the United Kingdom, and Japan are all testing more people than we are.
Well, I think the CDC at this point would agree with you, and I've seen these recognitions of the massive missteps in the testing rollout. Look, we thought we had a better testing unit in the United States. It turns out it wasn't true. People who need to get tested quickly without the big bureaucracy of the state public health departments controlling this. There's supposed to be 4 million tests that are about to be deployed. I know they recognize this mistake and are trying to do everything possible. But honestly, Scott, a test does not change how we treat a patient. We treat them the same. It does not change our management. It is important for tracing and for containment, but at this point, the virus is out there. Assume it's everywhere. Assume it's on every doorknob and every handle and every Uber car handle, and protect yourselves by using things like alcohol, Purell, some barrier when you open something, and minimize your contact and stop all non-essential activities.
Dr. Makary, we appreciate your thoughts tonight. Thanks for joining us.
Thank you, Scott.
All right, a lot more ahead tonight on this CNBC special report, Markets in Turmoil.